First, before entering the room, you would perform hand hygiene. Introduce yourself to the patient. Hello, my name is George. We're going to be performing an abdominal and nervous system assessment. Is that okay?
Yes.
And you would ask the patient their name, date of birth.
Crystal Waters, 3/18/1996.
Good. All right, so then you want to cover the patient's legs, lift up their gown for some privacy. And then first you want to observe just color of the skin. There's no rashes, ecchymosis, no lesions that you can see, no scarring or striae. You want to look at the umbilicus. It is midline, not protuberant at all. You want to look at the contour of the abdomen. Is it flat? No bulging. Look at the flanks, nice and flat. You want to observe for any peristalsis, which I don't see any, meaning there could be any GI obstruction. Next, you're going to auscultate before palpation and percussion. You're going to listen to positive bowel sounds in all 4 quadrants. Good. Nice strong bowel sounds in all 4 quadrants. Next is percussion. With the middle finger, you're going to be tapping throughout the entire abdominal area. Any changes in resonance, any hollowness. And then moving on to palpation, starting with light touch. And then a little firmer. Are you having any pain when I do this?
No.
Good. Okay, and then we're going to assess for any rebound tenderness, pressing down and letting up. Do you feel any pain?
No.
Going down or up?
No.
Good. Now, testing the right upper quadrant. I'm going to be testing for positive or negative Murphy sign. You're going to press down. Any pain?
No.
A positive Murphy sign could show acute cholecystitis. Now we're going to check for possible appendicitis with the Rosvig sign. That's tested in the right lower quadrant. Slight pressure. Any pain when I do this?
No.
Good, good, good. Now the psoas. I'm going to have the patient straighten their legs with their knee above their knee. Lift up. Any abdominal pain when you do that?
No.
Good, good, good. So psoas sign checks out. We're going to be checking for the obtruder sign. Bend your right leg for me. And when you press inwards and rotate inwards, do you have any pain here?
No.
Good. Last is the cutaneous hyperesthesia. Pinching the folds of the skin, of the abdomen, especially the right lower quadrant. Any elicited pain could be accompanying appendicitis as well. Next, you're going to percuss and palpate the liver and the spleen, bilateral kidneys. Do you have any pain?
No.
Good, good. That concludes the abdominal assessment. We're going to be moving on to the nervous system. Assessing mental status. She knew her name, her date of birth. She knows where we are and why we're here. That all checks out. We're going to be checking cranial nerves 1 through 12 now, starting with 1, olfactory nerve. You're going to have the patient close one nostril, breathe in and out. It's nice and patent. Next side. Good. And then you would have a known scent. Ask them to smell it. What does that smell like?
Coffee.
Good. And another. What does that smell like?
Cinnamon.
Good. Cranial nerve 1 checks out. Moving on to cranial nerve 2, the optic nerve. You would just take a Snellen chart, walk away from the patient, have them close one eye, read the bottom line for me.
Grant.
Good. Other eye.
Brooke.
Good. She has 20/20 vision. The first 20 means the chart is 20 feet away. The second number, the 20, is what a normal person with good eyesight can read from 20 feet away. So the optic nerve checks out. We're going to be checking a few of them in tandem. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and the abducens nerves. We're testing for extraocular eye movement. So have the patient follow your finger, just with your eyes, left to right, up and down, left to right, up and down. Good. Moving on to cranial nerve 5, the trigeminal nerve. We're going to be testing for sensation, starting with soft. Can you feel that?
Yes.
How about that?
Yes. Yes.
This? You feel that?
Yes.
Feel that?
Yes.
You feel that?
Yes.
Good. Then we move on to something a little sharper. Can you feel that?
Yes.
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 Good. Cranial nerve 5 checks out. We're going to be moving on to cranial 7, the facial nerve. Cranial nerve 7 is charge of taste on the anterior 2/3 of the mouth. Open your mouth for me. You would drop something sweet or sour on the front 2/3. Do you taste that?
Yes.
Good, good, good. Have the patient close her eyes, nice and tight. Open. Good. Smile. Good. Nice and even. No drooping. Now moving on to cranial nerve 8. We're going to be testing hearing. Have the patient close one ear and then rub your fingers together. Can you hear that?
Yes.
Tell me when you can't hear it anymore.
Okay.
Okay. Same thing.
Yes. Okay.
Good. Hearing is intact. Now we're moving on to cranial nerve 9 and 10, glossopharyngeal and the vagus nerve. These are in charge of the posterior third of taste. Have the patient, you would drop something sweet or sour. Do you taste that?
Yes.
Good, good, good. The tongue, we're going to be checking for a gag reflex. Open up. Good. Good strong gag. We're going to be testing the accessory muscle, the accessory nerve, which is cranial nerve 11. It's in charge of close, open. Don't let me close it. Okay. Now strength of the trapezius muscles. Shrug up. Good. Don't let me push down. And good. All right. Last but not least, cranial nerve 12, the hypoglossal nerve. Just testing the strength of the tongue, muscle movement of the tongue. Stick your tongue out. Go to the left. Go to the right. Up. Down. Good. Everything looks good. That's cranial nerves 1 through 12. We're going to be assessing motor function. You would have the patient walk, stand, testing for gait, strength, any balance issues. Everything checks out. Muscle bulk looks good. The tone and strength look good. Last, we're going to be checking tendon, deep tendon reflexes. Starting with the bicep tendon. Raise your arm. All right, good. Next is the tricep. Have the patient raise up. I'm gonna test the tricep. Good. And then the brachioradialis, 2 inches above the wrist. You tap. Good, good. The patellar, you would be hanging. The leg, about 1 inch below the kneecap. Tap. Good. And then the last is the Achilles. Tap. Good. All positive reflexes. Everything checks out. This patient is nice and healthy. That's going to conclude our abdominal assessment and our nervous system. Thank you.